Okay, guys, chronic pain can be very debilitating in all areas of life. It can be difficult to get rid of, and many sufferers have been told just to live with it. Can you imagine that? But our next guest says if you have neuropathy, it can be treated. Dr. Matt Thomas from 360 Neuropathy in Frisco is board certified in neuropathy and wants to help you live a better life. Hello, Dr. Thomas. What a lovely mission.
It's great. Thank you for having me back on the show, Hannah. I appreciate it.
Of course, we love having you. Let's get right to it. Chronic pain can be incredibly debilitating in every part of life. You've been on before and we talked about neuropathy. Could chronic pain be neuropathy? What should people look for?
Yes, I mean, chronic pain could be the result of several conditions, one of which is neuropathy. If someone's experiencing numbness, tingling, burning pains, electric shock-like pains, especially muscle weakness in the arms and hands or legs and feet, this could be neuropathy. Neuropathy typically starts off slowly and increases over time as the nerve damage gets worse.
So if someone's at home is listening and saying, check, 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 I'm experiencing these things, what should they now do?
The best course of action is to seek the help of a professional for an evaluation and an accurate diagnosis. There have been many advances in the treatment of neuropathy over the years, but neuropathy is a progressive condition, which means it will only get worse over time. It won't fix itself, and eventually it can become permanent. Once somebody gets to 85% sensory loss, it becomes very, very difficult to turn the condition around. We've seen people who have waited so long, and many of these people end up being confined to either a walker or a wheelchair for the rest of their life. It's very sad.
Yeah, that's heartbreaking for them and their families. So what are the typical treatments for neuropathy?
Typical treatments have been prescription drugs like gabapentin, Cymbalta, Lyrica, amitriptyline, even dangerous opioids. Other treatments include injections and surgeries, and both of these come with tremendous side effects and downtime. Now, at 360 Neuropathy, we take a more natural approach using natural means like low-level electric cell therapy to regenerate the nerves and reestablish blood flow to the arteries that supply the nerves.
So talking about these new treatments, how would viewers know if these new treatments would work for them?
Well, each patient is evaluated by one of our team members to see if our treatments are going to work for them. Then we develop a custom treatment plan for each patient. We use no drugs, no injections, and no surgeries. In fact, we have the most advanced non-surgical FDA-approved treatments for regenerating nerves and the arteries and blood vessels that supply those nerves.
It's got to give a lot of folks hope at home. Okay, so I understand you have an offer for our viewers, a $49 neuropathy evaluation. Is that correct? And can you tell me more?
Yeah, that's correct. That includes an exam, consultation, any necessary x-rays, and a report of findings. Our neuropathy exam is so thorough that we can pinpoint down to the percentage how much sensory loss a person has, and then we develop a treatment plan for each patient.
Some of these symptoms just sound so excruciating. So how quickly can people be seen?
Typically, we can see a patient in our office within 48 hours. Our doctors and team are here to meet the needs and treatments of each and every patient.